cat behavior can be confusing, but the explanation is usually simpler than you think. If your cat loves curling up on your head at night, you may wonder, is this a sweet comfort or a hidden concern? In this video, we'll walk through what research suggests about the bond between older adults and their cats, the potential plus sides and drawbacks of this cozy habit, and simple doctor-informed steps you can take to protect both your sleep and your health. You'll learn practical adjustments that keep the purr without the worry, and the gentle questions worth raising with your healthcare provider. Let's get started. Alright, let's start with the real-world reason this happens. Understanding your cat's instincts helps you appreciate the behavior before weighing any adjustments. Cats often sleep near our heads because we release warmth and scent from that area. For a cat, this is the ultimate sign of trust. Your head smells familiar and feels safe. It's their way of strengthening the bond they share with you. Think of it as a quiet love letter from your cat each night. While it's mostly harmless, knowing this helps you see the behavior as affection, not a nuisance. In the wild, cats seek elevated spots to feel protected from threats. Your head is the highest point on the bed. By sleeping there, your cat may be following a deep instinct to stay alert and safe. This behavior is normal and not a sign of dominance. It's simply your cat's natural way of managing their environment. If it ever feels crowded, gentle redirection can help. Cats have scent glands on their cheeks and paws. When your cat rests on your head, they're likely marking you with their scent, claiming you as part of their family. This is a strong compliment in the cat world. It means they see you as a trusted companion. For seniors, this daily reassurance can be an emotional lift, especially if living alone. Just keep in mind that the scent exchange is mutual, and washing pillowcases often helps manage any buildup. The vibration of a cat's purr has been associated with a calming effect. Some research suggests that frequencies between 25 and 150 Hz may promote relaxation and even support bone density. While no one should rely on a cat for medical benefits, the sound of purring near your ear might simply help you drift off. If the sound becomes disruptive instead, a small shift of position can still keep the purr within comforting range. Now let's explore what the companionship of a head-sleeping cat might offer your well-being, without making claims that sound like a substitute for medical care. Many older adults find that a close pet friend eases loneliness. When a cat sleeps on your head, you feel their presence, warmth, and steady breathing. This constant companionship can be reassuring, especially after loss or during times of reduced social contact. Research does associate pet ownership with lower scores on loneliness scales. However, if loneliness affects daily life, it's wise to also talk with a healthcare provider or counselor. Interacting with a beloved pet may lower cortisol, a hormone linked to stress. The simple act of listening to a cat purr near your head could have a gentle, grounding impact on your nervous system. Some small studies have even noted modest improvements in blood pressure among pet owners. While your cat isn't a replacement for blood pressure medication, these moments of calm can complement your daily wellness routine. Always continue prescribed treatments unless your doctor says otherwise. The steady rhythm of a cat's breath or purr might act like a natural white noise machine, helping some people fall asleep faster. For seniors who struggle with restlessness, this soft, consistent sound can be preferable to silence or electronic devices. Just be mindful that deep sleep stages require stillness, and a cat that shifts frequently could interrupt that. If you notice tiredness during the day, it's worth tracking whether the cat's movements are playing a role. Cats thrive on routine, and their bedtime habit can give your day a comforting structure. Knowing that your cat expects to settle on your head at a certain hour may help you keep a regular sleep-wake cycle. This predictability is often valuable for older adults, supporting overall circadian health. A steady schedule can also remind you to take evening medications or wind down activities at a consistent time. Talk with your doctor if you'd like to pair this with other sleep hygiene steps. Even the sweetest habit can have a flip side. Let's look at the potential drawbacks so you can make informed decisions about your health. A cat that needs, shifts, or purrs loudly can interrupt your sleep cycles. Older adults already face age-related changes in deep sleep, and added interruptions may lead to daytime drowsiness or trouble concentrating. If you wake up unrefreshed several mornings a week, it may be worth discussing your sleep quality with your healthcare provider. A simple sleep diary can help you identify whether your cat is a factor. Close contact with cat dander, fur, or saliva can trigger allergy symptoms, even if you've never reacted before. Seniors with asthma or COPD may notice increased coughing, wheezing, or nasal congestion. If you use oxygen therapy, any extra irritant warrants caution. An allergist can perform a simple test to clarify your triggers. Freshening your bedroom air with a HEPA filter and laundering bedding often are practical first steps. If you need to get up during the night, a cat on your head or nearby can be a tripping hazard in the dark. The startle of a sudden movement might also throw off your balance. For seniors, falls are a serious concern that can lead to injury. Consider a gentle redirection of the cat's sleeping spot to a nearby cat bed, and make sure the path to the bathroom is well lit and clear. Your healthcare provider can offer additional fall prevention tips. You don't have to choose between your health and your cat's affection. These practical adjustments can keep both of you sleeping soundly. Place a cozy heated cat bed right next to your pillow. Cats love warmth, and a consistent heat source can mimic the warmth of your head. Sprinkle a bit of catnip or place a worn toshirt of yours in the bed to transfer familiar scent. This gentle rewiring can take a few weeks, so be patient. The goal is to make the new spot more appealing, not to punish the old behavior. Encase your pillows and mattress in allergen-approved covers. Wash all bedding weekly in hot water to reduce dander buildup. Consider a silk or satin pillowcase, which can be less attractive for a cat's claws and easier to keep furor-free. If your budget allows, air purifiers with HEPA filters can make a noticeable difference. These small investments may help you breathe easier without banishing your cat from the bedroom. About 20 minutes before bed, engage your cat in a short play session to tire them out. Then lead them to the new sleeping spot with a treat or gentle praise. Set a consistent cue, like a soft blanket or a specific word. Over time, your cat will associate that spot with the calm pre- or sleep period. This routine also signals to your own body that it's time to wind down. Routine benefits both species at once. Sometimes, a cat's insistence on sleeping on your head can be linked to anxiety or a health issue. A veterinarian can rule out pain, vision loss, or stress that makes your cat clingier. They may offer behavior modification guidance or supplement recommendations that support feline calm. A vet visit is also a chance to update your cat's overall health plan, ensuring both of you stay well. Think of it as a wellness check for your entire household. Your doctor is a key partner in making sure your sleep habits support your overall health. Here's what to bring up at your next visit. Tell your provider exactly how often you wake at night and how you feel during the day. There are validated, simple questionnaires that can help gauge your sleep quality. Your provider can then help you decide whether a sleep study or a referral to a specialist is appropriate. Be honest about the cat's role. No detail is too small. This conversation can uncover issues like sleep apnea that are common but treatable. If you notice sneezing, itchy eyes, or chest tightness, mention it. A skin prick or blood test can confirm a cat allergy. Your doctor might suggest over-the-counter antihistamines, prescription nasal sprays, or environmental changes. For those with chronic conditions, even mild allergies can flare up more severely, so proactive management is key. Never start a new medication without discussing it with your health provider first. Bring your cat into the bigger picture of your health. If you use mobility aids, ask how to arrange your bedroom to prevent falls. If you have memory concerns, discuss whether the nighttime cat routine remains safe. Your provider can connect you with community resources like a local companion animal program if you ever need extra support. The goal is to keep the bond strong while protecting your independence. That's the practical version of what matters most. The big idea is to understand the instinct, weigh the benefits and risks, and make simple, safe adjustments that honor both your health and the bond with your cat. If this helped, like and subscribe for more practical guides that help you navigate the golden years with your feline friends safely and wisely. And, as always, talk with your healthcare provider before making any health changes. See you next time. If this helped, like the video and comment with the cat topic you want next.